Marijuana does have a number of terrible side effects that we're not even told about, particularly in today's world where marijuana use is being so widely popularized as it was in the time of the Roman rule. The Roman Empire at its peak and towards its decline, just in Rome alone, had over 700 opium shops where opium was sold. And opium is the addictive drug. The Roman Empire actually did have opium legalized. So I want to show you a few slides. I want to make you aware of some dangerous side effects of marijuana. The first, if you look at the brain and the heart as major organs and the gastrointestinal tract as another major organ, these are areas where marijuana does affect significantly. But that's not the issue. The issue here is we're sending young people diseases that we cannot otherwise explain, except they're in their 60s and 70s. Young kids coming in with stroke-like symptoms, chest pain, heart attacks. So on this slide, look at it carefully. There's an increased risk of strokes in patients who do marijuana. Intractable headaches, really bad headaches, really bad nausea, and intractable vomiting, dizziness, the lack of motivation, and sometimes acute psychosis. That is going completely loco, mad, insane, irrational. On the heart, marijuana does cause palpitations. That's a pounding of the heart. It can cause chest pain. It can cause the heart to race as if you're running 100 meters forever. It could also cause bradycardia. That is, the heart stops beating at its usual rate, instead slows down. Marijuana can also cause heart block. That is, a heart that beats so slow, it starts skipping several beats. And I've seen one young lady, a 26-year-old, who developed heart block, complete heart block. It can also cause an irregularly beating heart called AFib, as well as a heart attack. I've had 2 patients in the last 20 years that I've seen who developed heart attacks from marijuana. But let's look a little bit further at evidence. Texas Tech University Health Science Center, Dr. Matthew, and 2 other colleagues, Wilson, and looked at 29 volunteers, okay? And they measured heart rate, blood pressure, and blood flow in the brain using ultrasound, as well as skin perfusion, in other words, flow of blood in the skin, and checked tetrahydrocannabinoid levels while they were lying down and when they stood up. What came out is that severe dizziness occurs. Now, the reason for the severe dizziness is several-fold. One of them is a side effect on the brain. Another is an increased heart rate or even a decreased heart rate and a drop in blood pressure. But what Dr. Matthew and their colleagues measured were a drop in blood flow in the brain. That's important in developing a stroke. A drop in blood pressure. That's important in developing both a stroke and a heart attack. And a drop in heart rate, also important in the possibility of developing a heart attack. Now, psychosis, that's the madness. You can test somebody. Dr. Eugene is a professor of psychiatry at Washington University in St. Louis. They found out that 47% of patients who develop madness, craziness, that is acute psychosis, while using marijuana will later develop schizophrenia. So let's dive down a little bit. The excessive vomiting that occurs when people smoke weed. Okay, when I was young, in the 70s, whenever someone was throwing up badly, we suspected they were either pregnant or doing marijuana. But people are not aware of that, so they call it a new syndrome. The way marijuana can increase the risk of a stroke is pretty obvious from the previous mechanisms. But there's something that I want to share with you. It's called cerebral vasoconstriction syndrome. That is squeezing of the blood vessels of the brain so tightly a person presents as if they have actually cut off blood supply to that part of the brain. One gentleman that was mentioned in a case study with Dr. Namdi Huhegu and 3 or 4 other colleagues actually described a man who smoked enough weed, he developed a stroke and presented to the hospital with the blood vessels so tight. He got better about 4 days later and was discharged. Point taken here is that marijuana is not benign. Be careful what you smoke.